Wonderful as you drift down deeper and deeper and deeper and deeper now. Even as the fact that you're actually thinking about when this baby comes, oh, how beautiful it's going to be as you drift deeper and deeper and deeper into relaxation. So why do we want to use hypnosis then? Well, because it's a mind-body therapy. It changes the stress response. It improves healing. A lot of research showing, especially with long bones, the person hypnotized got better about 2 weeks before the one who wasn't. Facilitates a rapid recovery, gives the patient control. And that's a major issue. Endorsed by the American Medical Association in 1958, the British Medical Association in 1955, and the Pope in 1956. It's very simple. It's very simple. Doesn't mean it's easy, it just means it's simple. But the main thing is it works, and it works extremely well. So let's talk about uses again. We can use it for health, sports, education, working with people having trouble taking their boards, confidence. Everybody that I deal with, especially if has chronic long-term pain, they've lost all the confidence in themselves to ever get better. And then, of course, stress and anxiety. Acute pain, we're not going to talk a whole lot about that today. I'll answer some questions if you want to. Chronic pain, that's going to be our focus. Look at this. Cost. Ouch! Pain costs $80 billion a year. $80 billion because people don't go to work. So we want to go through the 6 stages. There's 3 levels, and what happens with hypnotic phenomena at that time. And the other thing is today you get to experience some hypnotic phenomena. Open your mouth and bite into the lemon. Feel your teeth go right through the pulp of that lemon.
Second class in the last 10 months, and I'm looking forward to the next one. I use it every day in my practice.
I'm always impressed with how articulate Ron is and how thoroughly he explains hypnosis, how the process works, and I always know that I can take things back to my practice that I'm going to use.
So one of the doctors I worked with knew I had taken the hypnosis course. He asked me to go talk to the patient and see if we could do this. I went over, sat down and talked with her for about 25-30 minutes. Once we understood what was going on, I placed her in a hypnotic trance and we transported her into the fluoroscopy area and did an hour and 20-minute ERCP. We removed 15 gallstones and a lot of sludge. Normally this would be a very, very painful procedure, especially since she had to be awake and had a large scope down her throat and halfway through her midsection. But just with the hypnosis that I learned from Ron, we were able to do it with absolute minimal discomfort, with no anesthesia or sedation whatsoever, and restore some quality of life back to this patient.
I've used the technique that Ron taught. I used half the dosage of medication that I had used in the past.